Your hip bursitis came back, and if you're being honest, you probably already knew it would, because this is not the first time. Maybe the injection helped for a little while, maybe the pain calmed down for a few weeks after resting, maybe PT, stretching, massage, chiropractic care, dry needling, or glute exercises gave you temporary relief. But then you went back, just walk more, or working out, hiking, traveling, or just living your normal life, and the pain came right back. That is usually not because your body is, broken or you're too old. And it is not because you just have inflammation in your body. And it's definitely not just because of your hormones and you're going through a perimenopause. It is because the actual problem was never identified correctly or corrected properly. After more than 20 years treating chronic hip pain, I see so many women being stuck in this cycle. Women get diagnosed with hip bursitis. They get treatments like injections or ultrasound to calm down the bursa, and their pain improves temporarily. But then the symptoms return right away when they try to return to their previous activities, or they just get back living their life. So what we know about this now is that the bursa is hardly ever a true source of the problem. Yes, the bursa can absolutely become inflamed, but the inflammation is usually a reaction to something else happening mechanically around the hip and the pelvis. In this video, I'm gonna walk you through why the bursitis label falls short, what is actually driving the inflammation, how to tell if this is your pattern, and what to do about it starting today. Most lateral hip pain is nowadays more commonly referred to as greater trochanteric pain syndrome, because researchers realize the pain is often not coming from the bursa at all. Yes, we might see the bursa being inflamed, but a lot of the pain is actually coming from the irritated tendons around the outer hip that have sustained repeated microtrauma over time. This is a result of poor loading strategies and hip mechanics. In simple terms, the outer hip is getting overloaded every single day in a way it cannot tolerate. This is actually very close to the same situation as shoulder rotator cuff degeneration or rotator cuff pain. The muscles around the shoulder joint aren't pulling evenly, and that puts some tendons under constant load that eventually causes some damage. And until that loading problem is corrected, the inflammation keeps returning. The same thing happens at the hip level. If we treat this issue as bursitis, we often go totally wrong with our treatment approach. That's when the treatment is often just techniques to calm down the local inflammation. If you think about this, the bursitis label just describes what tissue is irritated. It doesn't explain why the tissue became irritated in the first place. And that is the missing piece here. So if you did not know, the bursa is just a small fluid-filled sac that helps reduce friction between tissues. When it gets compressed over and over again, it becomes inflamed. The inflammation there is real, but the pain is actually coming from the tendons. See, if the bursa is overloaded, then the tendons are overloaded as well. If we treat this situation as a bursa problem, we miss the opportunity to address the tendon irritation, the tendinopathy, and build resilient and strong muscles and tendons to reduce that overloading that happens there. So think about those injections to calm down the bursa or the tendons. First, we know that steroids can cause tissue degeneration. Also, they turn off the inflammation, which is actually there to aid healing. The pain in the outer hip and inflammation is more like the check engine light in your car. Putting tape over it doesn't fix the engine, and calming down the inflammation without fixing the overload does not solve the hip problem. This is exactly why injections often fail long term. The inflammation kind of gets quieter, but the mechanical stress that created the irritation is still there. So the second the hip gets loaded again, the symptoms just return. And most women are never told what is actually creating this overload. Most women assume that if the outer side of the hip hurts, then the outer hips itself must be the problem. So they keep stretching their IT band, which by the way does not stretch. They foam roll the side of the hip. They strengthen the glutes randomly. They massage the painful spot. The IT band itself cannot be lengthened or tightened, but the muscles attached to it, like the tensor fascia lata, glute medius, glute max, they can alter the tension in it. Also, your pelvis, your hip and knee position can add tension to the IT band, which goes over the lateral hip area, causing extra pressure. The IT band itself is usually not the issue, but simply the forces that alter its tension. This is where we need to look at the muscles that attach to the IT band. Are they pulling evenly? Is your tensor fascia lata muscle, which is the TFL muscle, possibly tight and pulling harder because your pelvis is in an anterior tilt? Are your glute muscles not able to work properly? Again, because of your pelvis alignment. Why are they, weak or maybe overly stretched? Is your knee collapsing in when you do any kind of single leg activities with poor load? Is your arch of your foot collapse, or can you walk rolling through the heel to the big toe properly? Just a quick reminder, if you want to learn more about how I help women to reduce hip pain and say yes to their favorite activities again, I have created a free webinar that will walk you through the most common mistakes everyone does when trying to fix their hip pain and what works better. Also, don't forget to subscribe so that you won't miss any upcoming videos that are released every single week. Most women I see with recurring lateral hip pain have poor pelvis positioning and poor single leg loading mechanics. So their glutes might test kind of strong during some of the exercises, but the second they have to stabilize their body and pelvis during walking, stairs, standing on one leg, or just during movement, the stability falls apart. So the pelvis rotates or drops. The pelvis spins over the femur. The TFL takes over. The knee collapses in. The IT band gets overloaded. The tendons of the outer hip gets compromised and overloaded. And this happens every single step, every stair, every walk, every workout. And over time, the tissues become irritated and painful. That is why so many women have pain with walking stairs, lying on the painful side, walking, hiking, standing for longer periods, or just simply getting up from sitting. The issue is not simply inflammation there. The issue is that the hip is not distributing load correctly. And once you understand that, fixing it becomes a whole lot easier. Because now we stop treating the symptoms and start correcting mechanics. So how do you know if this is going on with your body? Here are a few things to ask yourself. Has the pain improved temporarily with treatment only to come back again? Does walking, stairs, standing on one leg, or exercise make the pain worse? Have you done glute strengthening exercises consistently but still not gotten lasting relief? Does the outside of your hip ache after sitting for a long time? Has anyone actually addressed how you walk, how your pelvis moves, how you move your body in general, how you move your hips, knees, feet, how do they handle load during movement? Or did they only treat the painful area? If this sounds familiar, you're not imagining things. Your body is showing you a loading problem, not just inflammation problem. And the good news is, loading patterns can improve. One of the first places I start with women is actually guiding them through some mobility and release work while we get the key muscles that stabilize the pelvis on board. Once we have obtained a good pelvis stability and good supporting muscle strength, then we can move up to gradually loading the outer hip structures. It really works every time when it's done in a smart way. Here's a little test to try out. Stand in front of the mirror. Step your right foot forward and bend your hips and knees so you're getting to the kind of lunge position. Can you keep your pelvis pointing directly forward, both knees align with the hips and ankles, or does your knee push in, the front knee? Does your pelvis rotate, or do you feel unsteady doing this? If yes, you might be dealing with poor loading mechanics that simply add more pressure on the outer hip structures, causing pain and inflammation over time. Often women approach me saying their hip pain is from hormonal changes. This is partially true, as lack of estrogen does reduce collagen in the body, putting tendons to a risk of degeneration. Now, the important thing to understand is that while hormonal changes can impact the pain and inflammation, improper loading mechanics are still the drivers in this pain. So hormonal replacement therapy like the HRT and the other techniques to balance the hormones can really help, but they do not replace the need to address the loading issue. Within the 20 years of working with hip pain clients, women with hormonal imbalances are always, and I mean always, having loading issues as well. In my experience, correcting both issues there is the best way. You did not fail at fixing your bursitis. You were simply treating the symptom without correcting the mechanical issue that was driving it. And once that issue gets addressed properly, the hip finally has a chance to calm down naturally. The outer hip pain that has been controlling your life is not necessarily a permanent issue there. It is often a sign that your body has been stuck in a poor loading strategy for a very long time. And that is something that absolutely can improve. What I would do is always start with an in-depth hip assessment to see what is actually going on in your body, and then based on that, creating a step-by-step plan that will gradually load the structures in a proper way. So unfortunately, there's no one-size-fits-all workout for bursitis to share, because what works for someone might make someone else work. Now, if you're interested in seeing what you might have missed with your previous attempts in treating outer hip pain, watch my free webinar. The link is gonna be below. Also, if this video helped you understand your hip pain differently, make sure to subscribe, because I talk about this stuff every single week. And really, feel free to leave a comment or question below and I will get back to you. And in the next video, I'm going to show you exactly how poor pelvis positioning changes hip loading and what you can do to improve it.